So today is November the 18th, 2009. We first saw Annie on March of 2009. Annie, would you like to explain a little bit about why you came to see us in the first place, and what kind of changes have you seen since you came in?
Okay, well, back in March I had finally reached a point that I needed more help than what medical doctors were giving me, especially when it was concerning my IBS or whatever label that you want to give it. I've had troubles with that for decades, and there just have really nothing that I've ever done suggested medicine, any sort of thing like that has never really helped me. So, and I wanted to do something that was holistic and not go the medical doctor route anymore. And a lot of things have happened since I've been here. You've found out a lot of things through lab tests and things of my chemical makeup and a bunch of things that aren't right and needed to be corrected. And you've done a lot of things. And today I'm free from any pharmaceutical drugs for the first time in probably 40 years, maybe
40
longer.
40 years?
Yes. Wow. I used to always have to take some sort of sleeping medication to go to sleep for almost all my life. Wow. I've done that, and I'm taking nothing except some wonderful supplements that I trust are the right thing for me because they're coming from you. And I'm just feeling like, I think this is what normal people feel like. You know, they go to sleep at night, and they wake up early in the morning, and they get their work done, and they feel good all day. You know, I think I feel normal.
Right. Well, you know, you'd be very surprised on what you think normal people go through. A lot of people go through a lot of stuff you've been going through, and they consider it normal just because they've been on, you know, the meds that you've been taking for 40 years. They think it's normal to do it, and so a lot of times they start thinking that feeling bad is normal, has become their normal. So how fast did you start to see changes?
Well, I can't remember exactly when I stopped, you know, the sleeping medication. I don't remember, some months ago, I guess. Okay. But recently something that, a supplement, or two supplements actually, that I started taking was almost like a night and day. It was just like the next day. I said, wow, I feel really good. And now I haven't had a bout of IBS, a month now.
Wow.
Not at all.
And how often were you going to these
well,
IBS or Irritable Bowel Syndrome?
It would last for months when it came on, and then a couple of months off, and then back months again, and it just seemed to be that was my lifestyle.
That's good. So what, before this point of you coming to this office, what's been done with you? Other people who's attempted to help you, what have they done?
Oh, so many things.
Well, just briefly.
Well, a lot of eating things. Don't eat this, do eat that. Those type of things. Antidepressants, for sure. Right. One of the things. You know, over-the-counter Pepto-Bismol.
Right. Okay. So the typical medical or typical traditional medicine is really the only route you've been through.
Yes.
In the past 40 years.
Right. I have not known any other course of action. So
how hopeful are you to regaining back to full health?
Right
0 to 100.
Well, I am like 100% hopeful that what's going on now is like, wow, this is just great. I mean, I can live a life. I mean, I can actually be, you know, I could go on vacation. Yeah. I could go out dancing maybe. Oh wow, I could be a normal person.
Right.
Yeah.
Which is what life is truly about. But you have any suggestions or any advice for any future patients?
I suggest that people open their minds to holistic medicine, functional medicine, right. What you practice here, and really open their minds to that, and stop thinking that medical doctors and hospitals are the only answer to health problems.
Now we know that medication has its place a lot of times for the acute short-term situations, but in long-term cases or chronic cases like you and the majority of the people in this country, how many years did the traditional medicine work for you?
Not at all. Never did.
Oops. Right? So.
And I was probably headed for surgery or something someday.
That's true, and that's where a lot of people are headed because a lot of times they don't know about this. That they again trust in their medical doctors for them to know everything, but if you look at their overall tool bag, it's quite small. It consists of medication and surgery. So it's quite small, and when most people ask them about alternative medicine, which they have little to no education in, that's what gets educated to the mass public. And so people go on 40 years of feeling crappy and feeling terrible just to be miraculously helped. I mean, you said you were homeless.
It feels like a miracle.
Right.
It does.
Which didn't need to wait 40 years. So,
That's sad.
is it okay if I share this information, this videos with students, doctors, and patients all over the place?
Absolutely. Hopefully I'm able to help others.
Oh, very good. Thank you, Annie. Appreciate it.
Thank you, Dr. Brady.